Welcome to Plain English Public Health Weekly Report. I am Richard Greenland and today is May 22nd, 2020. We'll start as always with the statistics on COVID-19. Worldwide we have about 5.3 million cases right now, along with approximately 340,000 deaths. In the US we have over 1.6 million cases and nearly 100,000 deaths. We'll start with a little bit of good news about the COVID-19 situation. First off, the CDC says that COVID-19 isn't actually as easily picked up from surfaces as they once thought. It's still a good idea to disinfect surfaces, but it's even more important to follow social distancing and face mask protocols. The FDA has approved another at-home test for COVID-19. It's a nasal swab test. Makes it a lot easier than what you would normally experience at the doctor's office. This test is made by the company Everlywell, which also makes a lot of other different tests for different things. It will cost $135. No word on if insurance will cover any of that, but it will be available around the end of this month. Moderna Therapeutics announced that a possible vaccine for COVID-19 has now passed its phase 1 clinical trials. Basically, some of the, or at least a lot of the patients taking the vaccine actually saw production of antibodies. Now, as we talked about last week, antibodies doesn't necessarily mean that you become immune to the disease. We believe that that will happen, and that's how vaccines generally work, but we're not absolutely sure that that's how this will work. Again, this is very early in the process, so there's no absolute guarantee, but it is promising. Moderna says that if everything goes as planned, they should have a vaccine available by about the beginning of January next year. Moving on to some not so good news about COVID-19. First off, we're going to talk a little bit about herd immunity. Herd immunity is where basically everyone just tries to get the disease so that everyone becomes immune. Like mentioned earlier, we still don't even know if COVID-19 works that way, where if you get it, you're then immune. Even if you are immune, herd immunity requires anywhere from 50 to 90% of the population to have that immunity in order for herd immunity to work. Most scientists say about 70% is average for most diseases. Right now, scientists estimate that less than 10% of the world population has been exposed to COVID-19. And if that's the case, and even if immunity is granted by being exposed to COVID-19, less than 10% is nowhere near the 70% or so that we would need for herd immunity to take effect. And this herd immunity, you basically hope that those that are already immune protect those that are not immune. You just have so many immune people around that it's hard to have two non-immune people meet up together. Scientists estimate that probably between 4 to 5 years is what it'll take for your herd immunity to happen if we don't have a vaccine. So it's very important that we get that vaccine. Once we have the vaccine, herd immunity should be quite a bit faster of a process. If it does take the full 4 to 5 years, scientists say that we'll probably lose hundreds of thousands of people to COVID-19. So we really need to rely on the vaccine, not herd immunity. Don't have any COVID-19 parties or anything like that trying to get the disease, because it's not worth it. Chances are you'll get it, you'll probably pass it to someone else that doesn't have a strong immune system, and people will die. So just don't do it. Researchers at Columbia University have looked into what might have happened if stricter measures such as the social distancing, the stay-at-home orders, things like that, had gone into effect earlier than they did. What they found was that if stricter measures had been put into place just 1 week earlier than they were, approximately 36,000 deaths could have been prevented. If we'd started those measures 2 weeks earlier, then as many as 54,000 deaths could have been prevented. Now, we can't go back to the past and change anything, and there's limited help or use in blaming people for why it took so long to actually get all this stuff done, but what we can do is learn from it. Right now, we know we need to use caution as all the different states and countries are reopening. So now, as we reopen, please make sure that you continue social distancing and continue using face masks. In other news, there was some flooding in Michigan this past week. 2 dams broke during that flooding, and there was some possible contamination from a Dow chemical company in that area. Some flood water got into the containment ponds, which do contain some highly toxic chemicals sometimes. The Environmental Protection Agency, or EPA, is currently planning to do an assessment on the area. They say that there most likely is not any immediate significant danger to people around the area, but just use caution if you live in that area. Finally, as the last bit of news we have this week, scientists at the University of Cambridge have found a way to turn pea protein, that's the main ingredient, in vegan burgers and sausages made by the company Beyond Meat. That pea protein, they found a way to turn it into plastic. And it decomposes within weeks instead of the years, decades, or even centuries for certain plastics that are the petroleum-based, the normal plastics that we see. So that's a real big step up for the environment. Thank you for watching Plain English Public Health Weekly Report. Please subscribe to get more updates. And also, enjoy your Memorial Day weekend. Remember, alcohol and driving do not mix. Have a great weekend.